Can genetic testing predict your stroke risk? Imagine if a simple test could tell you how likely you are to have a stroke someday. While genetic testing can provide some clues, it is not yet a crystal ball for stroke prediction. Your risk of stroke depends on a mix of factors, including your genes and your lifestyle. Genetic testing looks at your inherited DNA to find variants that might increase your chances of having a stroke. Advances in research, especially genome-wide association studies, have identified many genetic markers linked to different types of stroke, especially ischemic stroke, which is caused by blocked blood flow. Scientists have developed tools called genetic risk scores that combine these markers to estimate your genetic susceptibility. These scores can sometimes predict stroke risk independently of traditional factors like age or blood pressure, and may even outperform older genetic assessments in some groups. However, there are limits. Most studies have focused on people of European ancestry, so the scores may not be as accurate for everyone. Plus, stroke risk is complex. Many small genetic effects interact with environmental factors like smoking, diet, and physical activity, which genetic testing alone cannot capture. It also doesn't fully account for rare genetic causes or specific stroke subtypes. In real-world medicine, genetic testing for stroke risk isn't yet a routine part of assessment. It shows promise, especially when combined with traditional risk factors and new data from fields like multiomics and machine learning. For example, it might be useful for people with atrial fibrillation or those taking blood thinners, helping doctors better understand their individual risk. Overall, genetic testing can add to your understanding of stroke risk but should not replace lifestyle changes and managing known risk factors. Controlling blood pressure, quitting smoking, maintaining a healthy weight, and managing diabetes remains the most effective ways to prevent stroke. As research continues, genetic testing may become more precise and useful for personalized prevention strategies. Remember, always talk to your healthcare provider for a complete risk assessment and personalized advice. Genetics is just one piece of the puzzle, and your overall health and habits play a crucial role in stroke prevention.